Welcome to Our Village Circle, a podcast centered around authentic sharing, honest storytelling, and elevating the voices of parents and professionals alike to demystify the realities of new parenthood. We understand on a visceral level that with the joy of your new human also comes every other emotion under the sun. We want you to feel seen, heard, known, and held in this life-altering stage. We wholeheartedly believe that everyone's story has something powerful to offer others as they navigate their own journey. Hi, everyone. Welcome back to the Our Village Circle podcast. I'm your host, Jaylee Turner, and in today's episode, we're going to meet Heather White Swartz, a certified nurse midwife and the owner of Loudoun Homebirth and Healthcare in Northern Virginia. Heather and I met a few years ago when I was pregnant with my son, George. She was actually part of the team of midwives that carried me through the last part of my pregnancy, and Heather was present for the birth of my son. We've stayed in touch ever since. As I've moved into my own journey with birth work, she's always been available for questions and really been a great support for me. In this episode, Heather shares her own journey from starting out as a registered nurse, training as a midwife, and then working as a certified nurse midwife in a hospital-based practice, and how that transitioned to home birth midwifery. We also discuss the questions and concerns that many people may have regarding out-of-hospital birth and the state of maternal health care in the United States. We discuss how the birth world has changed with the emergence of COVID-19, the benefits of birthing at home for a low-risk pregnancy, and how family members and friends can support a newly postpartum parent during this pandemic. I hope that this discussion is informative and enlightening for you, and I hope you enjoy it as much as I did. Here, take a listen. Hi, Heather. Welcome to Our Village Circle. I'm so glad that you're here. Tell me a little bit about yourself and your family.
So my name's Heather Swartz. I'm a certified nurse midwife. I've been a midwife for a little more than 6 years, and I was a nurse. I'm still a nurse, but I was a nurse before that. So I worked in labor and delivery and postpartum. And I got into midwifery from my own birth experiences. I knew I wanted to be a nurse, and then my first pregnancy was a twin pregnancy. And I had the most amazing birth experience. And looking back, I realized I was completely lucky. That's all it was. I didn't ask any questions. I did everything they told me to. And I had an amazing experience because I just got lucky. And so I really realized that you need to know more about birth, and you need to be in a position where your provider is making good decisions with you instead of just telling you. And then I went on to have 2 more babies after my twins, and my last one was born at home. And that was just such a powerful experience and something I knew I wanted to do. I was in school to be a midwife when he was born, and I knew that was something that I wanted to provide as a midwife, but I also wanted to get some good experience under my belt before I was in a place remote from a hospital. Yeah.
Was it one of those things that you always wanted to do?
So I knew I always wanted to be a nurse. I knew I wanted to help people, and I didn't honestly even know what nurse midwifery was. And then once I learned about it, I was like, that's it. That's the perfect thing. It's that beautiful balance of having medical background and medical knowledge, but not using it unless you needed to, and like really understanding how to support normal physiological birth. So once I learned about what that was, it was like all the stars aligned, and I knew that was the path for me.
And it's people too. It's a people job.
Oh my gosh, yeah. And to be able to have those intimate connections, it just feels like such a blessing to be able to get involved with families, and especially when you get to a point where you've caught several of their babies, it just feels like such a beautiful blessing.
Yeah. Talk to our listeners a little bit about the midwifery model of care and how it differs from the obstetric model of care.
Yeah. So that's my favorite thing to talk about now. And in saying all of this, I don't want to ever come across as if it's a us versus them scenario, because it's a really important way to approach pregnancy to have all fields out there.
Yes.
Unfortunately, in our country, obstetricians who are trained surgeons and are trained to look at pregnancy as a disease process. Unfortunately, they end up caring for a lot of normal, totally healthy, low complicated women, and they don't have the time afforded in their schedules or don't even really have the training to talk about the big picture. How are you feeling about your pregnancy, and how is your spouse reacting to your pregnancy? They just don't have the time for that in their visits. And we as midwives are trained to look at pregnancy as just a normal physiological change, and really looking at the big picture and seeing how this is affecting your emotional status and spiritual status, and also your health status, and doing blood work and the stuff that is standard of care for all of obstetrics. But we just get connected. That allows us to have a little bit more of a connection with our client, and then our outcomes prove that we're doing it right, because we've got, looking statistically, we are cheaper. That's as far as low intervention and low complications. And we also have a really good background of having good outcomes. So I'm hopeful that it's going to shift in our country to become more like obstetrical care in England, France, Spain. Most of Europe uses midwives for the majority of women, and then doctors for higher risk.
Yeah, and there's certainly those pregnancies too that do require the hands of a physician.
For
right?
sure. Yeah, exactly. There's some mamas that need to have a higher medical, or who come into pregnancy maybe with something medical that they need to be addressed. So midwifery is not for everyone, but for sure it needs to be for the majority of women.
Mm-hmm. Yeah, I know that you are now a home birth midwife. Yeah. But when I met you were a hospital midwife.
Correct.
Yeah, so talk to me about your time as a hospital midwife and how that morphed into your time as a home birth midwife.
Yeah.
And what that difference has been like for you.
So that was a very purposeful path for me. So there's definitely different ways to get to home birth midwifery, and there's not a right one or a wrong one. But for me, I really wanted to see the volume. I wanted to see as many complications as I could, as many rare scenarios that I may not ever see again. I wanted to see what that was like, just based on having a practice that had heavy volume. And then, so I purposefully I interviewed with the group that I was hoping to work with, and they were women that I'd worked with when I was a registered nurse, labor and delivery. They were the midwives that really ran the show at the hospital that we were in, and so I knew that was the group I wanted to be for mentoring purposes. So anyway, I got my heavy volume, and I met wonderful people, and I really got a lot of validation that this is not the way I wanted to practice ultimately. Again, not that there's something right or wrong, home birth versus hospital, but I found myself really getting bogged down with antiquated policies that the hospital might have had, or generalized care versus being able to really individualize care related to timelines and how long someone's been in labor, or how long someone's pushed, for example. And having to really advocate for my client with the doctor or with the hospital ended up being more of a frustration than I thought it would be.
Mm-hmm. Yeah, because I guess, correct me if I'm wrong, but a lot of hospitals, the policies are in place for a reason, but then oftentimes a lot of interventions or a lot of things may occur more because it's hospital policy and not so much because of the individual patient. Is that correct?
That's very correct. And it also, I will tell you that from firsthand experience, there may be a really good big study that came out that talks about how we should be doing something differently, but it's going to take a long time before that big study then translates into a change in the way the doctors who I'm working with change their practice, and then also a change with the policy. And so it's really frustrating to be taught in school that we really need to follow evidence-based care, and then not to be able to do that at the bedside, and then to have that conversation patient to midwife is really hard. To say, yes, I hear you in what you're saying, however, this is what I need to do today. And I had to do that more often than I wanted to.
And especially now, because we have the internet, we all have all this information at our fingertips. And I think nowadays women are taking a more active part in learning about their pregnancies and learning about birth and learning about what they would like for their own birth experiences. And they're getting their hands on this evidence-based information too.
Correct.
And so then I can imagine it can become quite confusing when you come to a doctor or a midwife with evidence-based information and then not be able to follow through on it.
Correct. Most of the world views 42 weeks as a normal gestation, not in our country. And we had to really fight tooth and nail, and our backup doctors a few years ago had a policy of 41 weeks and 3 days. And that was really, honestly, a negotiation. And that was because they wanted...
Oh, wait, you had to negotiate too? 41 and 3?
Well, they wanted 41 and we wanted 42 as the defenders. So 41 and 3. But then to have that conversation with a client and to be like, why can't I go to 42 weeks? And I'd be like, I have to have you induced tomorrow. It was just such a terrible and just non-evidence-based way to practice. So,
yeah, I hear that a lot about the post dates. Like, the due date is viewed as this, okay, the baby needs to be out by this time, and anything after that is late, and the clock begins ticking, and
labeled as post dates at 40 weeks and 1 day. No, you are 1 day past your due date, and you have another week and 6 days before you're considered post dates.
Yeah. So then, okay, when I talk about out-of-hospital birth, even just passively in conversation, as a doula, I get a lot of raised eyebrows, and I get a lot of comments, even from people who are working in birth. And I think there is still a little bit of a stigma about out-of-hospital birth.
Right.
So I'm wondering, I'm going to read some real things that people have said to me about out-of-hospital birth. And as a home birth midwife, I just want you to comment on them, either debunk them or validate whatever they're saying or whatnot.
Yeah.
Because these are things that I have heard.
Okay.
So the first one is midwives only support natural birth.
And that's actually a myth just for midwifery in general, I'll say. Because in a hospital, we often had clients who decided they wanted epidurals, and that's completely their choice, honestly. And that's something that a midwife can support you through all the way, just like an unmedicated birth. In the home, we do measures that are not medications, but it doesn't mean that you're without comfort. In a home birth, no, you're not going to have anesthesia involved, so no epidurals, we don't use nitrous, no IV pain medications, nothing like that, but we do offer water birth, and we do therapeutic touch, massage. There's a lot of things that we're doing that is keeping you comfortable that's not medication. So I'm not anti-medical birth for sure. I'm not anti-hospital epidurals or what some mamas need. And honestly, in a transfer scenario, that's something I could wax poetic about that. Sometimes an epidural is a medical way to stay out of the operating room. I've said that before, that maybe that's what a really exhausted mama needs at the final stage. So,
I know, like I had high blood pressure, and what I talked about with my midwife actually was if my blood pressure skyrocketed, we were going to try an epidural before magnesium.
Correct.
To see if that would help to lower my blood pressure.
Yeah, so it's a tool that can be a part of your medical management. But yeah. So, next one.
Yes, next one. It's reckless and unsafe.
Yeah. So, I try not to be judgmental of anyone, honestly. Yeah. But I think that what makes home birth safe is having a caring and skilled provider in attendance. So, there is, I don't know if you've heard the term free birth, but that is something that is a whole nother topic for a whole nother podcast.
Yeah, so for our listeners, the term free birth is something that's become a bit of a movement in the birth world. And it's when a birthing person chooses to labor and birth their baby at home by themselves or with their partner, maybe a doula in attendance if they can find someone who will support it. But it's without the skilled midwife or care provider in attendance. I think sometimes home birth can get confused with free birth.
Yeah, a really good point. So some people think that home means you're remote from everything. No, honestly, I bring everything with me. We bring a lot of stuff to your birth, and I always say we only use about 10% of it, but the rest is for emergencies.
Yeah, so what are you bringing?
We have oxygen tanks, oxygen tubing and face masks for both mom and baby, so if we're able to fully resuscitate a mom or a baby if necessary. We're bringing our skills, so we've got NRP, which is like baby CPR, and then also grown-up CPR, or BLS it's called. And then a bunch of IV equipment, medications for bleeding. Let me think about all the other stuff. Suturing items and numbing agents if we need to do any repair. So we have all of that with us, and I use maybe about 10% of it, but the rest of it we have for emergencies.
So you're prepared for a lot of different situations.
Yeah, and actually I'll bring up birth centers right now too, because we do have everything that a birth center has, exactly. And we're certified nurse midwives, so we're able to give medications, including the oxygen and the medications I mentioned. And that is often a misconception that somehow a birth center is safer than home birth, when really it is exactly the same equipment.
Yeah, it's just a different environment,
exactly.
Right?
Yeah.
Yeah. Okay, the next one. Midwifery is an outdated practice.
Their views perhaps are outdated, but as you mentioned, there's different types of midwifery in our country. Yeah. Certified nurse midwives have been around for years and years, and they are becoming more utilized, but there is definitely nothing outdated about it. In fact, I think we're getting more and more advanced. So, for example, the school that I went to is one of the oldest midwifery schools in the country, and they started off riding horseback up into the hills in Appalachia to get to families that couldn't get to hospitals. And then now they became one of the first online schools for midwifery, and so you do a lot of the didactic start over online. And it's super technologically savvy and really advanced as far as online school goes. So it's really transitioned through the years.
That's great.
Yeah.
Yeah, that's really great to hear. Next one. Home birth is messy.
It is. that one I'll validate. It is, but we know what to do with the mess. And a lot of it, we'll have our clients buy a birth kit that has, if you've had an in-hospital birth, the disposable chucks pads and the kind of absorbent things that they use, we have all the same stuff at home. And one of the things that we can do is, usually around 36 weeks, we'll look at your space and kind of talk through where you envision having your baby. Oh my goodness, your white base of your bed that's fabric, that needs to get covered with a shower curtain liner. So those are a couple dollars, and those are hot commodity at a home birth.
Oh,
shower liners, like shower curtain liners, you can get them from the dollar store. Things like that. We have a bunch of tricks on how to minimize. But yes, birth is messy no matter where you are.
Yeah, that's true.
Our goal is to not look like you've just had a baby once we leave your house. So yes, you have a baby in your arms, but we tidy and clean and organize everything before we leave.
Oh, so you all take care of cleanup? We
do, yeah. Or at least organize. We'll have the trash is all in a trash bag that needs to go out, and the linens are all ready to get washed, but it doesn't look like you've just had a baby.
Oh, that's great. That's awesome. The next one, this is a big one I hear. What if you decide you want medication?
Then sometimes it'll be your 8th baby, and you'll say to me in the moment, heck with this, I want an epidural, and I know that the baby's about to come. So been through that experience, and then I just remind you that I can see the baby, and then you have your baby. Other times it is a conversation, and I don't mean to make light of it. We are experienced enough to know the difference between you saying, oh my gosh, this is really hard, I wish I had an epidural, to you saying, I would like to go to the hospital and get an epidural.
Tapped out.
There is a completely different way to have that conversation. And we support you in whatever you want to do, honestly. And so if a mama is exhausted and just says, I don't want to do this anymore, we arrange transfer. We're not going to question or try to talk a mama out if we know that the birth isn't imminent and that it is actually safe to get to the hospital and that she won't have her baby hopefully in the car on the way there.
And what does that process look like, the transfer process?
So we break down transfers into emergency and non-emergency. Most home birth transfers are going to be non-emergency. So that's going to be the mama and the partner going by car. And that would be for a case like that we just talked about.
Right.
Emergency, we're calling 911. So that's something that's we can stabilize a mom and or baby, but we need to get to a higher level of medical care. Yeah.
And do you stay with the client in the event of a transfer?
We're going to talk about in the absence of COVID, because COVID has really changed everything right now. But yes, ideally, we're not just giving the medical report to their oncoming providers, but we're also then taking over kind of a doula role with the clients, because we're no longer making medical decisions with them, but we're there for all the other support that we can be. Yeah. And that's a conversation we have prior to the birth, too. So that's when we're getting to know our clients, we talk through, even if they don't ask us, we tell them what hospital we'd be going to that's closest to your house and what that would look like.
Yeah. And then the last one is, it's only for people who have money.
Not true. So it's usually a big surprise to people that our fees and the way that we structure our practice is we have a package fee. So it's expected deposit at the first visit, and then we like the remainder at 36 weeks. But often that whole amount is less than a lot of families' deductibles. And we have clients that use flex spending accounts or like health savings accounts. And then also the other thing that we're starting to see is becoming more popular is health shares. Usually those are faith-based I think there's a few that are secular, but really a good idea to look into for young, healthy families that you're able to, the pregnancy and birth reimbursement is almost 100% for a lot of those companies. So
wow.
Something to look into. That's a whole nother podcast too, is how to pay for birth.
Yeah, I was going to ask, one thing I hear a lot, and actually one of our points of consideration for our first baby was our insurance covers most of this. So it would be cheaper for us to have our baby in the hospital because of the insurance coverage.
Yeah.
So if a pregnant person is considering an out-of-hospital birth or a home birth, and that is what they really desire, what are some questions that you would recommend the birthing parents begin asking?
Yeah. So we, for example, don't take insurance up front, but after the baby's born, we can then bill your insurance company. And then for our practice, anything you get back, we give directly back to you because you've already paid us. So some of those families, that means that they're getting the entire amount back.
Wow.
And other families don't get anything back. And so that's a conversation that they should be having with their insurance company and asking if they can get an out-of-network exemption, and explaining that we're certified nurse midwives too. So that's something else that typically is covered at a higher rate than certified professional midwives, at least in Virginia.
Yeah. Well, that's good to know. That's really
good to know. It's also, looking at the hospital practice, it's not uncommon to hear from clients when I was in the hospital that they were getting bill after bill, and that they had thought that maybe their insurance was going to cover it at a higher rate, but then didn't cover the pediatrician that came in the room for 5 minutes, or didn't cover the hearing screen that was done. So it's really important to ask those questions up front on kind of what your total package is going to be.
Right.
Yeah.
We had that happen.
Yeah.
Yeah, we ended up, most of our billing was for the stay at the hospital and for the food and for the the pediatrician consult. He came in for 2 seconds to talk to us, and it was like $200.
Right?
Yeah.
So that's something else. We, in a lot of home birth practices, really pride ourselves on being super transparent. Yeah.
Yeah, absolutely. So another thing that I get a lot as a doula is I have friends reach out to me with questions about their own pregnancies or pregnancies of family members. I get the concerned family member texts a lot. So here's one that I want to read this to you. This is one I received recently from a friend. She said, "Hi, Jaylee. My sister-in-law is about to have her second baby. The first she had in a hospital, and the baby had to be taken to a NICU at another hospital due to breathing problems. Because of needing to wear a mask and the ridiculous hospital requirements, she has decided to give birth at home with a midwife, which is great, but she lives in a remote area approximately an hour from any hospital. My question for you is, do midwives have a plan for situations like this? But then, how can you plan for an emergency when help is so far away? My husband and I are well aware that it's her choice, and we do not plan on saying anything about it, but we are so scared. Can you maybe help me see that this choice, although wholly her choice, is not irresponsible?" I'm sure you get questions like this a lot.
We do, and we are in Loudoun County, and so especially looking out into western Loudoun, you could be potentially an hour away from a hospital. Even in Northern Virginia, we think, I'm sitting in a more populous part of Northern Virginia, but this is a big area.
You could be sitting in traffic.
You could also be sitting in traffic. Yeah, right. Excellent point. So our goal in any kind of an emergency situation once the baby's born is stabilization. And that we have the same skills and we're able to do an artificial airway, to do oxygen support. So our goal is to recognize that the baby needs further evaluation and further treatment, and to stabilize the baby in the meantime. So often that means that we'd be riding on the ambulance with the family, because we would have a higher level of medical training than the providers in the ambulance.
Because they're trained, it's usually EMTs, right?
Correct, yeah.
In an ambulance.
Correct. So that's true for breathing issues, any kind of a heart rate issue, anything like that for baby. And same is true, honestly, for mom. So we could do the same kind of stabilization. It is a really important distinction between certified nurse midwives and certified professional midwives. And this is a point that I'd want to bring up too, is that again, when we're defining the differences, I don't want there ever to be a perception that one's better than another, but it is an important factor that in some states, those certified professional midwives cannot give medications legally, including oxygen. So that for myself, when I was looking into home birth, that was a really important factor for me. That's not true in all states, and I'm hoping that will change and that they'll be able to do more stabilization that we can do. But right now, that's another important question I think you would ask.
Yeah, absolutely. So then, what sort of circumstances would qualify a pregnant family for an out-of-hospital birth. And what sort of, so you have the situations during pregnancy that would, quote unquote, risk someone out of a home birth.
Yeah. So it doesn't have to be your second baby. So some home birth practices will require that you've had a vaginal baby before, but we do not. And actually the statistics back that up too, that it's still a safe option if it's your first baby. We like to review your medical history. For example, if you're on insulin and you're diabetic, that's not a safe option for you. You need to have, not to say you couldn't potentially have a midwife and an unmedicated birth, but you need more facilities, more managing, especially for the baby. Mm-hmm. So I guess the easiest way to answer it is anything maternal that would be a red flag, that would be something that would need to have a specialist involved, or anything that comes up for baby, that we feel like the baby just has a chance of needing a higher level of care post-birth. So for example, if there's a heart defect or something that comes up in the anatomy scan ultrasound, that would be a conversation we'd have, that it just erring on the side of caution that we'd want that baby to immediately have facilities if it needed urgent surgery or something like that.
So just as parents are being judicious about where they give birth and who their care provider is, you as a provider are judicious about which clients you all are comfortable taking.
Correct.
Yeah.
If the outcome could change based on your location of your birth, then you need to be in a hospital. Mm-hmm. So that's something that we think about when we initially meet clients, and for screening purposes, we have where our clients are really scrutinized before we take them on.
Yeah.
Right.
What about during labor? What sort of scenarios do you see that would warrant a transfer, or that would classify as an emergency that needs to be taken to someone else's hands?
Yeah, so there's a number of things. Thankfully, most of them are fairly rare. Our goal is to catch a warning sign of something and hopefully get you transferred to a higher level of care before it's a big problem. Yeah. So for example, blood pressures, or obviously heart rate issues for baby, bleeding for mama, fevers, anything that just deems that you, once the baby's born or in the rest of the labor process, if we're recognizing this first steps of what could be an infection or what could be a bleeding issue postpartum, something like that, it's our job to get you to a hospital.
And how long are you with the parents after the birth?
So at home, we typically stay for about 2 or 3 hours, and there is a lot of stuff that happens in those 2 or 3 hours. And if there's any kind of challenges with the baby not wanting to nurse, or if the mama is having a hard time getting to the bathroom, anything like that, then we stay longer than that. But usually it's about a busy 2 or 3 hours. And when I say busy, that means that the baby is still on the mom. There's just a lot of stuff happening around her. So making sure she's getting a meal in her belly and making sure the baby's latched. So I guess both of them are getting meals in their bellies.
Right. Oh my God, I'll never forget. I just had the crappy hospital burger,
but
it was the best meal I ever had in my life.
Yep. So that's actually a really fun thing I'm seeing as a trend for home birth. Is often there'll be other family in the house that's cooking. And so you smell these amazing smells coming out of the kitchen, and someone's making an amazing pasta dish, or this, anyway, so it's really nice to see that mom tucked into her own clean bed and eating a big bowl of whatever grandma has cooked her. It's just a really beautiful postpartum.
That sounds wonderful.
Yeah.
So then, I'm skipping around here, but walk me through what a home birth looks like from your end. So from when you get the, I think I'm in labor, or I am in labor call, to when you close out with the client for the last time.
Yeah. So that is super dependent on whether it's her first baby, whether it's her fifth baby, if it's not her first, the speed of her last labor. So that's very specific instructions that we're giving that mom. So it's hard to talk generalizations, but I will say usually for first moms, we are having a lot of, okay, let's time your contractions for another hour, and have you tried laying down? Did you go for a walk? Like talking through things to see if this is going to be actual labor or if it might fizzle out and come back in a couple days. That's all support that we're giving them over the phone. If it's not your first baby, I usually say that, especially our moms who've had a hospital birth, if you're thinking about, this is when I would want to go to the hospital, that's definitely, we want to be there by then. So our goal is to get there before active labor really kicks in, but we want to make sure that labor is not going to start and stop, which is super common. It also depends on geographically where the mom is. So if she's a good distance away, we might come a little on the early side and maybe set up everything and then leave and give her a little space to walk around and see what's going to happen. stay throughout the active labor. So that could be 10 minutes once we get there, or it could be 2 days once we get there. And then it's usually, for our practice, it's one nurse and one nurse midwife, and they stay the whole time. And then coming back for the postpartums, so the 24-hour visit, a 48-hour visit, 2-week visit, and a 6-week visit.
And that's all in the home?
And that's all in the home.
Oh.
So we're coming to them for everything.
So is that in replacement of what would normally be the pediatrician's visit?
So our families, we want them to take their babies on day 3. So day 3 postpartum. So we're seeing them at 48 and 24, and we're doing full assessments of mom and baby. So we know that they're okay. If there's anything out of the ordinary, then obviously they take the baby a little sooner. But usually by day 3, that's when they're going to see their pediatrician for the first time. Yeah.
Yeah, I remember our birth was very easy, but my recovery was a little rough. I remember that time being very chaotic because once we were sent home, we were not home. We were being sent from place to place to place. And they say postpartum is supposed to be a very restful time and you should be in bed and blah, blah, blah. And I remember thinking, like, why do they have us go to the pediatrician 2 days after we got home from the hospital? Like, I should be in bed. And this has been, you and I discussed this earlier.
Yeah.
Our pediatrician, in the light of COVID, has started doing home visits for the well visits. And I recently called them and said, this is something that you should do all the time, not just during COVID times.
Yeah.
But you guys are coming to the home after the birth and you're checking on mom and baby.
Yeah. So
that's
for
wonderful.
24 and 48 hours. And that's, that's part of the other point of pride for our practice is our nurses are very experienced. So they're going to pick up on something even that, so I have full faith that this baby and this mom are well assessed in those first couple of days. And then it would be ideal if we could get a pediatrician to come out and see our families in the home. I'm hopeful that's going to happen more and more.
That would be wonderful, just to facilitate that healing time for the parents.
Yeah.
It was so hard to get out of I think our appointment was at like 9 o'clock in the morning.
Yeah.
And it was just so hard to get out of I think we were still 25 minutes late because it was our first time figuring out how to leave the house with a baby.
Yeah.
Like, what do you need to leave the house with?
And then they poop, and then they're crying, and then you have to get the car seat, and it's cold, and what a mess.
Yeah.
It is actually within our scope of practice to care for babies for the first 6 weeks, so that's something we kicked around, but that would necessitate changing things with insurance, and it's like everything in this country, it's just a little bit broken. Yeah. So I'm hopeful that it will get better, and whether it's us then doing the newborn care for the first few weeks or getting a third party that could come with us, we're still working on how to make that happen because across the board, nobody wants to leave their house. Nobody. Yeah. COVID aside, not even related to the pandemic, but just in general.
Yeah.
And how do we say to someone, you need to be resting, I don't want you getting out of this floor, and then you have to go to the pediatrician.
Right.
Yeah.
Yeah, I remember thinking that. And I guess when our kid was born, we didn't even know that we had to go to the pediatrician in the first couple of days. So that was a shock to us. So yeah, that sounds so wonderful. And with more FaceTime, have you noticed a difference in how they are experiencing that postpartum period?
I can say with every essence of my being and a full heart that we have to see clients in person, and that's something else that's been a little bit of a challenge in 2020 is Hillary and I, who's my partner, are very careful about how we're approaching keeping everybody healthy, so masks and lots of hand washing and wiping down our equipment, but a lot of practices are going to virtual visits for postpartum, and things will get missed. And I will say that, and unfortunately I think we're going to look back at statistics for 2020 and see that there really was an uptick in postpartum complications because you cannot do a virtual postpartum visit. You cannot. And the standard of care in our area is still to just see moms at 6 weeks, and a lot of those moms are virtual, and that just breaks my heart. You're going to miss emotional challenges, you're going to miss physical issues, poor healing. There's so many things that you actually have to be with a person to assess.
I have a friend who had a C-section about 6 weeks ago, and she messaged me last night and said, I just think it's so strange. My provider just told me that my 6-week visit was going to be virtual.
Yeah. How are you going to look at a wound and make sure that it was healed?
For a C-section, for a C-section scar.
Without touching it, and that is just a personal little, like, I'm hopeful that will get better after we get out of this pandemic. But just in general, there needs to be really careful postpartum follow-up because that's just such a challenging time for so many women.
And you are getting a lot more FaceTime with them too than even if we were in non-COVID times you would get, right? Because you're seeing them at 24, 48 hours. You're seeing them at 2 weeks. You're seeing them at 6 weeks.
Correct.
So there's their continuity of care.
Yeah. Absolutely. And something else is hard to say objectively, but I will tell you that walking into a house, you can tell how everyone is.
Yeah.
And yes, the house is going to be messy. You expect it to be messy, but you can tell the difference between a mom who wants to cry out for help and can't versus a mom who's tired and things are a little chaotic, but she's okay.
Right. And what do those signs look like? Just for anyone who's listening that is walking into the home of someone who has just had a baby.
So sitting down with a mom and having her be able to tell you how she genuinely is feeling physically and emotionally and actually having that conversation, you can see if they're not doing okay. So it's hard for me to quantify like what the hallmark signs are, but in general, I don't care about mess. Of course you're going to have laundry and of course there's going to be dishes in the sink because you should be taking a nap, but do you have a partner that's around? Do you have any outside support that's coming in to bring food? Is it all takeout food? Have you eaten healthy foods in the postpartum period? That's such an important thing. And again, I'm saying all that without judgment. I love Chick-fil-A. But and then also, especially in families where there's other children, are they in a safe place? Are they running around and generally unsupervised, or are they still running around but mom's got one eye on them? I don't know, it's hard to quantify, like I said, but you can
it's a feeling, like you intuit
who's doing okay and who's not doing okay.
Right.
Yeah. And I will also, we mentioned this earlier too, that's something that we start talking about what their plan is going to be postpartum. We start those talks even in the first visit, especially with our families where it's your first baby, and then also in the families where there are other children already. What's the plan for the kids? Are they going to be at the birth? And then who's going to help postpartum? Who's going to take them to the park when you take a nap? And, just talking through who's going to walk the dog. All the logistics of things that we can see, they're cues to us on things that are going to be a challenge postpartum.
Right. And that's a thing that I don't remember talking about in my visits.
All focused on the birth. Usually.
Yeah, everything. Yeah. Actually, even I started with an OB and then I transitioned to a midwife. But when I was in the OB, they didn't even want to talk about the birth because it was too. I was asking questions about the birth at 12 weeks and she was looking at me like I had two heads for thinking about it at 12 weeks. Yeah, I remember that. But yeah, I do think that in hindsight, the postpartum plan is
so important. Yeah.
Yeah, absolutely. So, what changes have you seen in the birth world since the onset of COVID?
So really interesting, and I feel like I'm in a very small minority of people who are like, COVID's been great. And I say that obviously there's so many challenges and it's something I'd like to go away, but it has really opened up a lot of people's eyes to the idea of having their baby not in a hospital. Right. And so that I'm going to take as a benefit. Mm-hmm. In that I was back to the beginning of our conversation when you were talking about, I've heard this, and people will say, who would ever have a home birth? It's almost as though it's on people's radar a little bit more than it ever has been socially.
Yes.
And I'm going to take that as a benefit because I think that's then obviously what's pushing our numbers up because we're busier this year than we've ever been. And I'm hopeful that the next step is going to be that insurance is going to cover it at a higher base. I'm hopeful that will happen, but really just for the social consciousness, I think, especially in Northern Virginia, you don't get as many eyes wide about, oh gosh, you're having your baby at home. It's, oh yeah, that makes sense. Why would you want to go to a hospital?
I was having a conversation with my boss recently, and she brought up the fact that a lot of people are turning to out-of-hospital birth. Yeah. And a lot of it, I think, is driven by the restrictions on who you can have.
Absolutely.
As your support people. I know I have a lot of friends that are currently pregnant and their partner hasn't been able to be with them for a single visit.
Correct.
Or a single ultrasound. And I remember at one point in New York, people weren't even allowed to have their partners.
That was a small time, but that became a human rights issue.
Right.
It did, and that's how that was changed to allow at least the partner to be there. But for sure, that's a lot of, so just from back in March, there was a week when things first started really exploding that we got 30 transfer inquiries in a week.
Wow.
And it was overwhelming to hear all these poor women who are feeling panicked and panic is not a good reason to drive you to home birth. But practical thoughts about, I don't really want to expose my kids to the waiting room at a doctor's office. That was a lot of the idea that we were coming to them for all the visits really helped. So we don't expect our clients to mask during labor, and we're not doing COVID swabs in the absence of any symptoms. So there's a lot less steps that we're taking in the home just because it's a safer environment. Yeah, but thanks, COVID.
Thanks, COVID.
Putting home birth on the map. So,
yeah, absolutely. And I'm noticing too, there's a lot less of a taboo around it. It's seeming a lot more reasonable to people.
I would really like to get to a point socially where you're at a party and someone says, I'm having my scheduled C-section next week because my baby's too big. And everyone goes, oh, okay, I understand. And then the person next to them says, I'm going to have a home birth next week. And everyone's, oh my gosh, why would you do that? Why would you put your baby in danger? And have that conversation flip to the point where, I don't mean to say that one's not acceptable, one is, but to have it just be a part of normal birth. To have it be more a part of normal birth than interventive birth.
And I think too, there's space for all
absolutely
kinds of birth. I think for some women in certain situations, an elective C-section really may be the best option for them. I 100%
agree with
if they've had previous trauma or anything really. But I think there should be as little judgment on that as there is for a home birth, but that's not often what you see.
Correct. No, for sure. There's a lot of women that have C-sections, not for good reason, but for sure there are women that absolutely that's the way their baby needs to come out. But you're right. Yeah, it just needs to be all of it without judgment.
Yes.
Is my social goal.
Yes, that would be amazing. I didn't quite realize it until after I had my baby because I knew the way I wanted to do things.
Yeah.
And to me it was normal. But it was so interesting after I had baby and I met other moms and people started telling their birth stories and talking about how their babies were born, like looking around the room and seeing people's reactions to other people's birth stories. I started to realize how much work we still need to do in the normalization of all birth.
Yep.
Yeah, for sure. So then what sort of concerns are your clients expressing to you right now, and what sort of challenges are you seeing?
So I will say that a lot of financially, this has been a really challenging time for a lot of families. So we're trying to be as graceful as we can about finances not being a stressor for anyone, especially if they have an unexpected expense or an unexpected job change or job loss. So taking that into consideration. It is, I will say that it's because a lot of kids are not in school and a lot of partners are not at work, the house itself tends to be a little chaotic. And you can see that wearing on the mom a little bit. So that's been a little bit of a challenge. Even if they're not verbalizing that to you, you can tell that these days are maybe without moments of peace for her.
Yeah.
I know you hear me say that.
I so hear you.
Yeah. So that's also been a challenge that we've been seeing. I think that especially postpartum, it's been really challenging for moms when you get to a point where you want to go out and see the world, to not feel comfortable doing that with a newborn has been a huge challenge. Our practice back in early March, we had our very first get-together where we were hoping to start a postpartum support group. And we had over 30 moms come with their babies, and it was amazing. And then literally, the world shut down a couple weeks later. So actually, it was February. It was right before this all happened. And we anticipated doing that every month or every other month. And clearly there was a need for it, but we just can't safely do it right now.
Right.
So,
wow.
Yeah.
Wow. Yeah, postpartum, that was what drove me to start training as a doula.
Yeah.
Actually, was when COVID hit, the first thing that came to my mind, I lost my job, my life completely shifted, but then, even though all of that was happening, the first thing in my mind was, what are all of the postpartum moms going to do? That was all I could think about. I was, oh my God, all these postpartum moms, they can't have their support systems. They can't get out of the house. That was huge for me, was getting out of the house.
Yeah.
And I was like, what are they going to do? And that was really my driving factor
for sure.
towards getting into this work, because I think right now, this is a time where birthing people need more support than they ever have.
Yes.
Ever.
Yeah. I agree.
Yeah, absolutely. So, challenges aside, what has been your practice's safety protocol for COVID?
So as I mentioned, I'm actually wearing a mask right now, so that's why my voice might sound a little muffled. So my partner and myself and then our nursing staff, we all wear masks for every patient encounter. And that's been an interesting thing too, because some clients don't want us to, but we really feel like we need to follow the guidance of the state. And I just personally would feel terrible if I ever got someone sick unknowingly. So we're wearing masks, we're doing crazy amounts of hand washing and wiping down of our equipment. We're also reminding our clients that if anyone in the house has a fever or a cough, that we'd like to not have them be in the room for the visit. And then obviously, I don't even want to say this out loud, but we have not had anyone test positive for COVID under our care.
That's great.
And that is a point of, it's going to happen, but for those visits, especially in early pregnancy, we might do some of those visits virtual as much as we can.
And are you seeing evidence coming out about COVID and pregnancy and birth?
It's going to all be in hindsight, I think.
Right, because it's just so new.
We're connected within the birthing community in this area, and we are seeing a lot more things that you just don't see very often, like differences in placentas, unfortunately early losses. And I think once 2020 is over, we're going to have more data to look back on. But yes, anecdotally, we've been seeing, just from talking to my peers, there's a presence of something that we've not seen before.
Yeah. That's going to be really interesting to see soon. So then, what advice are you giving to clients right now for whom COVID has changed their ability to receive support during this time?
So I guess what we're saying is to still follow the science. So trying to really minimize your exposures as much as you can. We have seen a lot of families do this successfully, where they've had parents come and stay with them and then be with them for the first couple weeks before baby comes. And so then their bubble has gotten expanded a little bit to include more help and more people, but they're all still safe interacting with one another. Mm-hmm. So we've seen that work for a lot of families. We've had drop-off scenarios where people are stopping by and leaving food on the stoop and things like that. Anyways, I guess in saying ways to ask for help postpartum is give people specific things that they can help you with that's still safe, like going to the grocery store for you or bringing by some food. Or it's hard, normally you'd say take the kids to the playground, but even that's not really safe a lot of times. So really keeping the people that you do feel safe, having them help you as much as you can, and then just getting creative. There is something to be said for having a Zoom conversation with a friend, or there are a lot of church services that clients are doing online. So things like this still help you emotionally and spiritually, I think can be really positive too.
Mm-hmm. Yeah, there's a local organization around here that does support groups for postpartum women. Mm-hmm. They used to happen at the hospital, but since COVID, they've all gone online. Yeah. And because of that, because it's a statewide organization, all of the support groups are on Zoom. Yeah. So there is a group at pretty much any time of the day. You can get on the website and be like, oh, there's a meeting in 15 minutes, and you can just press the button on your phone, and it's wonderful. I even think that the virtual groups would be beneficial after in-person groups are able to convene, because I can't tell you how many times I wanted to go to a support group, and then the idea of getting out of my house by 10 a.m. was just not
especially
realistic, and I didn't go, and then I still felt like crap.
If it's February or if it's, so for sure. I'm hopeful that after COVID blows away, that a lot of the things that have been the positives of this are going to stay in place. Like you said, for the virtual, having that as an option, having an in-person as an option and having a virtual as an option would be ideal.
What is your favorite thing about being a home birth midwife?
Oh gosh, it's going to have to be a short list instead of just one thing. So I'll say this way, the things that I have fallen in love with that I didn't think about before being a home birth midwife. Pets are a huge part of what we do. It's so funny too. Like, I love animals, and I've got dogs and cats and chickens at home. But getting to know someone's dog who like really wants to be sniffing your armpit while you're measuring the mom's belly, or like really in your space. Yeah. And being totally fine with that, because that's a member of their family.
During a birth, do you find that having the pets near can help the mom with oxytocin?
Oh, for sure.
Helping labor to progress.
Yeah. Some of my favorite birth pictures are of a dog curled up right next to the pool, or there's one where a mom's like leaning over in a pool and the cat's walking by and she's petting it. That's just a beautiful part of birth.
I love that.
The other part I love is having the older siblings really get to know us, because in an office situation, oftentimes if they were there, the kids would be nervous because they didn't know what was going to happen because it was the doctor's office. But now, like, we literally will see little faces pressed up against the window. The midwives are here, and they'll make me pictures, and we'll get stickers. Like, it's just so fun.
So cute. Oh my God.
But that also then translates to this being a really normalized thing for them. Like, they know when we're going to help their mom get their baby out, and then when they're seeing us coming for labor and then coming postpartum, like, we are part of how that happens, and it's normal for them. It's not this scary thing where mom goes away and then comes back with a new baby.
I love that, because that's the next generation of
for sure
people who are either going to be giving birth or supporting a birthing person.
Yeah.
And so that's wonderful that it's like normal for them. Yeah. That's like changing the culture of birth.
Yeah.
By having kids present. That's amazing.
There's about 17 other things that I absolutely love about home birth, but I'll stop there.
Okay, what is the most challenging?
The driving, honestly. Northern Virginia, that's also been a little bit of a bonus for COVID, is that initially, it's not really so noticeable now, but initially there weren't as many cars on the road, and so that part was nicer. There was less traffic, but we live in Northern Virginia. There's a lot on that toll road all the time, or fighting traffic on 66. So I've done books on tape. I listened to a lot of NPR.
Yeah, a lot of podcasts.
Yes.
Yeah. What resources would you share with parents or families wanting to know more about their options for out-of-hospital birth?
Good question. The ACNM, the American College of Nurse Midwives, has a really great website, and you can do a zip code search for nurse midwives. So that's a way to see what midwives are in your area. Now, it's hard to distinguish then who is home birth versus hospital, or who is out of hospital versus hospital. I'm speaking again to Northern Virginia, for example. There is a grouping of out of hospital providers, and so if you Google in your area out of hospital midwives, you should get some kind of a local organization that's pulled it together for you.
Okay.
And then also recognizing state to state, they recognize licensing a little bit differently. Certified nurse midwives, or CNMs, are licensed in all 50 states, but certified professional midwives, certified midwives, there's all a little bit nuanced differences state to state.
Okay, and I'll link that in the show notes as well.
I wish there was a national search engine, but there's not one. So if someone out there wants to create it, that would be awesome.
Hello, somebody out there want to make it? So where can listeners find you?
So I am Loudoun Homebirth, and so people in the area know Loudoun is Loudoun, homebirth.com. And I'm Heather, and my partner Hillary. Our contact information is on our website.
Wonderful. And do you guys have a social media account as well?
We do, yes. So we're on Facebook, we're on Instagram.
I'll link that too. Thank you so much for joining us. I'm so glad that you could come today. And I loved this conversation and picking your brain about all of this. And I just think you're wonderful.
Oh, you're sweet. This has been such a pleasure. I really obviously love talking about what I do, and if we can change the cultural narrative about what home birth is like, I think that's important.
Yeah, I agree. Thank you so much to Heather for joining us today. You can take a look at our show notes for all of the relevant links that we discussed in today's episode. Next time, we'll meet Sarah Eiselcorey, a teacher, musician, and mom of triplets from Northern Virginia. In this first of 2 episodes, Sarah will take us through her own journey with unexplained infertility, going through fertility treatments and a subsequent IUI, and her experience carrying and birthing triplets. Feel free to follow, like, and share this podcast with anyone that you feel may benefit from it. We're also on Instagram and Facebook at Our Village Circle, and our website is www.ourvillagecircle.com. Until next time, bye-bye.